Ladies and gentlemen, boys and girls, welcome to my channel. And let me once again tell you, I'm talking about Together for Sustainability. Today we are going to talk about SDG3 Good Health and Well-being. So let's start. By 2030, two-thirds of the humanity, which is 6.5 billion, shall be living in urban areas. 23% of deaths are caused by pollution and environmental issues, including cardiovascular, cancer, diabetes, and hypertension. 90% of the world's population breathes contaminated air. 235 million people currently suffer from asthma. 39% of adults are suffering from overweight and obesity. COVID-19 has created major impact on health globally. In near future, we shall be spending 25% of our income on healthcare systems, which is ridiculous. SDG 3 is linked to quality, access, and affordable healthcare services. Major issues related to healthcare systems are as follows: reproductive, maternal, newborn, and child health, chronic and infectious diseases, mental health, and road safety accidents and substance abuse. Half of the world population still lacks the essential healthcare services. This is the situation globally. Preventing unintended pregnancies, reducing adolescent childbearing, and sexually transmitted disease is crucial to the well-being of women and children. SDG 3 aims to reduce the death rates of mothers, newborns, and children under the age of 5 years. It is also equally important to a reduction in fatalities and ill health due to road accidents, suicides, pollution, or contamination of air, water, and land. Communicable diseases, non-communicable diseases, mortalities also require affordable healthcare systems. Preventing maternal mortality is one of the major SDG target. As per SDG, it should not be more than 70 per lakh of live birth. This refers to pregnancy till 6 weeks after birth. Preventing newborn and child deaths, under 5 mortality rate to be less than 25 per 1000 live birth. Reduction in non-communicable diseases by 1/3. Promotion of mental health and well-being. COVID learnings will help us a lot. Tobacco and substance abuse is excessive and must be reduced. Products like protein powder, almond or soya milk, brown bread or brown rice, and green tea are marketed on the name of healthy food, which is a mere publicity. This also costs much more than the regular food items. Schemes launched by Indian government in last 5 years on health and well-being are many. One of the major one is Ayushman Bharat Yojana, and again Ayushman Bharat digital scheme. Medical treatment is made free by government for below poverty people up to 5 lakhs of rupees. They can go anywhere and they can get themselves treated and they have not to pay. Of late, we are passing through third wave of Omicron, which is Wuhan virus. And we have seen how stressed were our healthcare systems during phase 2 of Wuhan virus. Millions of people died all over the world, and that also includes developed countries like US, UK, and Europe. So, health and well-being, they cannot be put at number 2. They have to be number 1. We have seen no oxygen for the patients. We have also seen that beds were not available, doctors were not available, nurses were not available. People were dying on the roads. So, a good healthcare system which is accessible, affordable, and can be availed at any point of time is the definition of good health. And that is where the world has learned how to take care and what to do and what infrastructure is needed for good health. We have lost our own near and dear ones during phase 2, and we don't want to lose anybody more. So try to understand, the importance of good health infrastructure. I am an auditor and I go for audits to various places all over India. And I always check the health infrastructure and CSR, which is corporate social responsibility, and the expenditure the company makes on CSR. And I'm happy to say that most of the companies which I have audited had donated oxygen concentrators to various villages. So that is where a good backup is being made available. Oxygen is available now and there is no problem. But if because of lack of competence in several hospitals, there were major fires and several people, including children, died because of fires. So we need to learn from that and improve ourselves. We need to think about SDG 3. We have already talked about SDG 1 and 2, about poverty and hunger. SDG 3 is also very important because without good air to breathe, good water to drink, good soil to produce crop, we cannot become healthy, and hygiene matters a lot. Government of India has created Swachh Bharat Yojana for better hygienic conditions, mainly for the rural population and women. So government is doing a lot. Let us also try and see that how we can make good health and well-being. Now let me also tell you that well-being is not only feeling good, no disease, or no complaints. Well-being is freedom from mental stress, then physical health, then emotional health, psychological health, and everything related to overall health. So it is very important that we think about good health and well-being globally. And India is doing a lot, but because of its high, very, very high population, things are not becoming simple. And the records are always showing lower rating, but it is not like that. India is doing great. It did not do anything earlier, but now it is doing lot of things. So let us all come forward and support this initiative. I would request all of you to like, share, and subscribe to my channel so that we keep on spreading awareness on SDGs, climate change, global warming, and better life. Thank you.